Welcome back. Thank you so much for staying with the program. You're watching Morning Cafe every day. On 25th September, the world marks Pharmacists Day. That is the conversation you're having this morning. The theme for 2025 is Think Health, Think Pharmacists. And it comes at a time when the pharmaceutical sector is facing a lot of conversations around regulations, who should do what, who is bigger than what. And with me in studio, I have Dr. Lucas Nyabero, a member of the Pharmaceutical Society of Kenya, to tell us everything about pharmacy and pharmacy practice in the country. How are they doing? Have they increased as of 2025? Karibu sana, good to see you again, this time on a different platform. This theme is Think Health, Think Pharmacist. And Dr. You as Dr. Lucas Nyabero, how do you resonate or relate with this year's theme? And why do you think it's important that we think about, pharmacists when we talk about health?
Thank you so much again. And I remember we were here, I think, for vaccines at some point. Regarding the theme, I want to go back to what pharmacists are.
Yes.
And then that will tie in very well with what the theme is. Pharmacists are the most successful healthcare personnel. They are normally very good caregivers, very good educators, and they're the last person that you see before you start care. Think about it this way. You have a headache, you go to the doctors, you see the doctor, and then the doctor will prescribe a prescription for you. You will go through the other care, and then just before you go home, you pass through a pharmacist, which is the last check. So everything that has happened. So when you come to me, I'll ask you, what was your initial problem? Why did you go to the doctor? And then based on that, I compare with what the medication is to see that does it make sense or it doesn't make sense. In addition to that, I will guide you on how to get the best outcomes on those medications. How do you take it? When do you take it? And then also I'll mention to you, what are those things that you have to worry about? So if you look at all that, that's just health. We are trying to tell you, we're trying to explain to you that here's how you can be healthy. Because your body needs help. That's why we're giving you a medication. So how can we get the best for this medication so that you can go back to being who you are? And that's where the health comes in. Yes.
And speaking about what a pharmacist is, let's just outline that, clarify that. It's a posh word for chemists, right? Because, there is a little bit of confusion when you talk about pharmacy and you're talking about the last line of care before I start my medication. Then the pharmacist and chemists, what is the difference?
Pharmacists and chemists.
Yes.
So let me answer that in a different way. So when you're a pharmacist, you go to school specifically to learn how does your body interact with drugs. So you spend the time, for those who do, they're different. You can either do 6 years, some people can do 4 years, but you spend your time just trying to learn how do medications work on a patient. Why do you give medications? It's because your body is not doing what it's supposed to do, so you're trying to help your body move, get to where it's supposed to get to. And as a result, physicians, very good at diagnosis, and they will tell you, they'll find exactly what diagnosis you need. We spend 6 years, sometimes more, learning the drugs. So how do we match the two? And that is where now the pharmacist comes in. Now, vis-a-vis what you asked about the difference between the terminology, I think it's mostly terminology mostly. There is not a major difference between a chemist and a pharmacist. It's which term do you want to use? Pharmacist is what has been used more frequently and around the world mostly. Chemist has sometimes been used to the space itself. To be where the pharmacist works. All
right. So do you feel like Kenyans truly understand your role as pharmacist and gives you credit? Because you're talking about you have indeed gone to school, some 6 years, you have degrees, and we also have the pharmaceuticals technologists, right, who have undergone the diploma program. So do you feel like we as Kenyans really understand your roles as pharmacists?
No. That's a simple answer. And I think that comes back to us as pharmacists. We have not been out there to explain exactly what we do and what the difference we can make. So I have worked with physicians who will hand over prescribing to me, who will tell me this is the patient, these are the goals, how do we get to where we need to get to? What are the best medications? If we talk of pain, for example, the number of meds that are available for pain are many. So depending on whether your liver is functioning well, your kidney is functioning well, what condition are you having, there's a medication that will actually we optimize the pain management. And there's some medication that will make things worse. I study those. That's what I do. I mean, there's some people I tell I'm a drug dealer. What I mean is I work, I deal, that's what we do as pharmacists. So I am the expert here. So ask me about medications. When you walk into a pharmacy and you ask, you need to understand, what were you given? So here's what my goal is always, anytime I deal with a patient. When you leave my presence and you find a 4-year-old, you can explain to them what your condition was, what medication I gave you, what that medication is supposed to do, what it's not supposed to do, and you should be able not to say the white pill or the pink pill or the yellow pill, because that doesn't say anything. So it's the educational part to make sure you understand. Now, when we step up as pharmacists and are able to do exactly that, it's very hard for people not to understand what you do. When you give the care that they need to see it from us. And sometimes we don't quite see it. We don't quite give it the way we should because of other pressures that are there. But the key thing is, I have been known to say, and I might have to make sure I'm clear here, that UHC will not be achieved unless the pharmacist is actively involved in care. Because when you get the wrong medication, it causes other problems. The healthcare system has to pay for those problems. So in essence, you came in with the one problem, you live with 2 problems, so then now we have to pay for 2 problems. And we could have just dealt with that one problem optimally by giving the right therapy for it. Yeah.
So does it mean that as it stands, pharmacists are currently sidelined from delivering quality care? Because if you're talking about pharmacists have to be involved, they have to be at the center and at the table, decision-making tables in regards to achieving UHC. Have you been sidelined and why?
We have not been sidelined, but we can do more. Yes. I think there could be more involvement in how pharmacists, how we prescribe. The way we use medication needs to be tweaked a little bit. It still puzzles me why you can walk into a pharmacy and buy antibiotics. What do you know about those antibiotics? Why are you taking them? Each antibiotic is supposed to be used for a particular condition. In those conditions, the physicians will prescribe it, and the lab will do the labs. And you know exactly which antibiotic will actually work for you. And what I mean by optimal, what's the least amount of drug you can take to get rid of this infection? If you get the right drug, absolutely you get it. Now we have this big issue that is happening, the antimicrobial resistance, where antibiotics are not working. And the reason why they're not working is because you go down to pharmacy ABC. First of all, you get a medication from there because you asked for it, and the person on the counter gives it to you, and you go home with it. What are you doing? What is it for? What are the side effects? Why are you taking it? Did you get checked? You had a cold. That's a viral infection most of the time. Why are you using antibiotics for that? And then when you really need the antibiotics, they're not there for you because they're already gone. Your body is so used to it. The bugs themselves have known how the drug works. And now you can't even kill them. That's how you get resistance. And that has actually cost lives. Yes.
So do you think fellow pharmacists in the country are very passionate about stopping unnecessary antibiotic use? Because you're talking about we come to the pharmacist and just demand for medicine without proper checks because that is what we think works for us. Then are all pharmacists that passionate as you are about telling a patient that we're not giving you this because you need to go checked?
I think again, in life, every time, everywhere you are, there's always room for improvement. I think there's room for improvement in how we do the whole prescribing and getting medications out. The systems need to be there where no medication leaves any facility without a prescription that came from a licensed prescriber. And those licensed prescribers should also be maybe categorized to see who can give what. If you've not trained to, if you're not an oncologist, why are you prescribing oncology medications? Do you really understand how that works? So I think we need to, those are some of those areas that we need to improve. How do we make sure that each and every medication that leaves any pharmacy is actually, can be tracked to understand why was it given, who prescribed it, who's managing the safety of the patient, which is the most important. Because when you don't have a physician managing you, who's managing that safety? Who knows which drug was? And then how can we get the pharmacists more involved in the safety bit? How do we make sure that your organs are not going south, whether you're in hospital or not in the hospital? Because if you push your organs, then we have to replace that kidney if it's a kidney. We have to replace that liver, and the healthcare system has to pay for that. Why? Because of a mistake that happened of the drug that you were given that one was supposed to be given. Or maybe you took it with something else that you shouldn't have been taking it together. Yes.
All right, let's talk about the issue of cadres and unity in the healthcare sector. Because you know, we've seen doctors taking up space time and time again. They are in front of Afia House demanding for their rights, the CEOs as well. But we rarely see pharmacists, you know, in the streets demanding for 1, 2, 3. And in the, you know, KMPDU, the clinical offices, there has been a lot of rift between who is better than who should do what, who should not touch what in these, you know, health facilities. So as pharmacists, are you feeling seen? Are you united together with these doctors, these clinical officers, and what are the challenges that pharmacists are facing in the country?
Interesting question, because we are part of KMPDC.
KMPDC?
KMPDU.
Okay.
Yes, we're part of it, and actually the current president is actually a pharmacist. So when they speak for us too. As regards to the union, so I'm going to say something here. When you go and learn how to play golf, you're a golfer. When you go learn how to play football, you're a footballer. So there are various levels of learning. So you could play in the big leagues or the small leagues. So it depends on where you are. So I think what we need, we need to understand what the knowledge base you have and put you in the situation where you can best provide care. UHC is going to be very difficult to attain if we don't clearly know what we can give, what can we optimize, how can we optimize our knowledge? Because if everyone works to the top of their license or the top of their registration or the top of their knowledge, we will bring top knowledge from every area to achieve this unique thing. And it's possible, and we can do it. Again, like I said, we all, every time you, unless you're not alive, you have room to improve. Any system has room to improve. And that's some of the things that we need to improve. How can we optimize the knowledge that we have from the people that are providing healthcare? Yes.
And that being said, you as a Pharmaceutical Society of Kenya are members of KMPDU. Let's talk about Kenya Pharmaceutical Associations, because they are pharmacists as well. But I do understand that they are the ones on the diploma program. And the question that I ask, and I will ask again, is about the rift and the lack of unity in the program. Sometime back in 2022, that PSK, the Pharmaceutical Society of Kenya, tabled a bill before Parliament that, you know, sought to make a little bit of changes in how pharmacists operate. And that also wanted a phase out of, you know, Kenya Pharmaceutical Association, those who were with the diplomas, and now to just remove it completely. Then that clearly is a rift. And I remember that time the president said, the president of KPA, Kenya Pharmaceutical Association, said that that is professional bullying. Then that clearly is a rift between pharmacists. Do you really recognize these Kenya Pharmaceutical Associations, the ones under diploma program?
Correct. So maybe one thing to mention there is KPA is an organization for diploma holders who are not pharmacists. They're pharmacy technologists. So that's just a clarification. So, like I said, let me go back to something I said. Practicing top of your knowledge and top of your license, which means you practice at the best way possible to optimize the knowledge you have. That's what I'm saying. We are not saying one is poorer than the other. We're just saying, where has your knowledge base gotten to? You can't expect a general physician to be handling a neurosurgery because they have not trained for neurosurgery. They are physicians, yes, they're doctors, right? But they cannot do that because they have not been trained to do that. So the training levels of both pharmaceutical technologists and pharmacists is different. Different by the time you spend in school. As a result, for whom much is given, much is expected. So pharmacists are supposed to be able to carry the weight of how therapy is done. And that's what I'll say. Now, as regards to professional bullying and other things, there's some of these things are statements that I probably will not be able to understand what was behind the context of that. What I understand is this. If you look around the world and look at the demarcations of how care is provided, it is very clear on who does what for it to be optimized. And that's what we need to understand. We need to understand that what is the knowledge you have, how does it help healthcare, and how are you going to best do that? If you go to some other countries, no pharmacy is run by none other than a pharmacist. The license of the pharmacist is the one that is actually on the line there. And anybody else who works in that particular facility, any medication that leaves, any patient who's harmed, it all trails back to the pharmacist as the highest level of entry to care. That is other jurisdictions. We had our own unique situation here where we've allowed, or the system has allowed, other people other than pharmacists to run pharmacies. And those are things that we need to come and have a come to Jesus moment to understand what we need to do. And how can we again optimize the knowledge base that we have, without which we'll really struggle in achieving what we want to achieve.
But is everybody ready for that conversation? PSK and KPA. Even I understand as you celebrate World Pharmacist Day, this is also their day, in as much as you know they are the way they are. Okay, this is their day.
Absolutely, yes. It's pharmacy, yes.
And are they ready to come to the table to have this kind of conversations? And even as you answer that, the pharmacist ratio to the population is also quite very low, and the pharmaceutical technologies are spread across rural areas. Then if you're talking about phasing out the diploma holders, then what does that do to underserved communities who really depend on these pharmaceutical technologists?
Sure. So we'll go to the Constitution. It also says that every person is entitled to the best available. Best available, that's one. Two, it was not the situation or the conversations that we're having about diplomas and pharmacists there was a system that was put together by PPB of how the technicians and technologists can upgrade to pharmacists.
Right.
So get the knowledge to move up so that you can be able to function as a pharmacist. That is actually, and there are several schools that are actually doing that right now. So the idea was to upgrade that, because there was gray areas of what can you and what can you not do. Upgrade that and then come up with another system of assistance in the pharmacy system, which is what a lot of the jurisdictions around the world do. They do have a pharmacist, and then they have support system that make sure. We are all required, we are all needed to make sure we can support healthcare. So the issue is not whether we need them or we don't. We do need everybody's hands on this. We don't have enough. If you look at the ratio of pharmacists to the public, we are way behind. We need to have more. The issue is what quality, how can we make sure that everybody who's out there is doing what they're supposed to do? How many of us are going to go out there and actually give out medications that we shouldn't give out? How many of us trying to figure out, why are you getting this? Why are you getting tramadol? I mean, tramadol is a narcotic. I mean, why are we getting it without a prescription? Why are you getting antibiotics without a prescription? How do we get people or professionals who will guide the patient, not be guided by the patient on what care they need? How can we make sure that all our healthcare personnel receive the necessary knowledge to do that at the optimal level? And that is what we're talking about. Now, about the rift, siblings always fight.
Yeah.
We are siblings. We sometimes have issues and do this and that. I think ultimately we both care about the patient. The question is, how do we best, again, how do we optimally provide that? We may need to have some hard truths. We may need to come to the table and decide things. And we do have regulators who are actually supposed to, it's beyond my pay scale, but it's within their pay scale to make that decision. But I'm just giving you, from my experience in other jurisdictions, we can do this better.
All right. And there have been calls for the Pharmaceutical Society of Kenya to be at the central or to play a central role in KEMSA's forecasting and, of course, procurement as well. Now, the question will be, what are some of these institutional reforms that you would want to see at KEMSA and at the county level as well? And this is to deal with, say, to reduce stockouts and, of course, reduce corruption. And how do you, as PSK, I know this is a mouthful for you.
No, it's not, actually.
How will you, as PSK, now monitor compliance if you're talking about trying to reduce stockouts at KEMSA and, of course, deal with corruption in KEMSA as well?
Okay. It's a loaded question. Let me start from one side to the other. Again, as I said, the person who's in charge of therapy is a pharmacist, because they understand which drug works best, because that's what they went to school to do. So they can know we should not get 2,000 of this. We need maybe 2, because we only use 2. There's very unique situations where we use this drug. So we don't need 2,000 of it. We just need maybe 2 or 20 to hold up. So that means that's stock management. So it's stock management based on your patients. So that is one way. The other way is to make sure that the data that we collect. Now, other jurisdictions will make sure that each and every prescription that leaves has a trail, such that if you asked how many, what drug do you know, how many Lipitor tablets were actually dispensed in the country last year, do we have that data to say it was this many? That means all pharmacies, wherever you went, do we know how many of those ones were prescribed? Maybe we need a system like that that is going to be able to bring in everything so that we know what is our utilization, not how much we purchase. What is our utilization of medications? I think right now we are using mostly what do we purchase, and the assumption is if we purchased it, we used it. We went to, I do also sometimes, we went for an audit, a global fund audit, to a hospital in a different county, which I will not name. And they had a stock of medications for a disease that was more than twice what the nation needs. This is one county, one hospital. And they did not see the disease. They had seen 5 cases last year. Yet the medications they had were more than what Kenya needs for this particular disease. Those are some of those things. Do we have the best qualified professionals leading from stock controlled up? From where? From the basic, from the primary care centers. Do we know how much we are using of what? Now, I'll give credit that there's a lot that is going on in terms of data collection. Now, it's a question of where we get to a point where we actually utilize that data for purchasing, for stocking, and other things. But also remember, in addition to that, remember that there's some other challenges that cause problems with supply chain. These are things that all these things, remember what happened during COVID. It was very hard to move things around. API sometimes in shortage and all that. I think one of the other things that the government is working on really hard is local manufacturing. How can we locally be able to provide commodity security? How do we make sure that pharmaceuticals, we can do them here? I mean, a country like Bangladesh closed their doors and now they're exporters. They're not only meeting their needs internally, but they're exporters.
All right, let's hear some feedback even as we close this conversation. Fred Mukoi saying, following live from Arusha. Rogers Nyariki kutoka Amsterdam, Netherlands, niko ndani ya show. Hapa Renga anasema following morning cafe from West Pokot. Emmanuel Montella from Likoni. Murugi Gitonga is saying, completely agree, prescriptions should only be given with proper medical knowledge. The risks of misuse, resistance, or harmful side effects are too high otherwise, and people do not realize this, unfortunately. Makuririn is saying, great morning show on this side of the world. Thank you so much for watching. Any special occasion today as you celebrate World Pharmacists Day?
Well, I'm going to be updated on that. We are definitely going to, I think we have a few events that are happening. I will, we'll post them on our site.
All right.
Yes. I think what I want to mention also is that I was...
in 30 seconds.
In 30 seconds,
yes.
for sure. Yes, I also want to mention that I was the previous CEO, the immediate past CEO of Pharmaceutical Society of Kenya, and now I'm the CEO of Elara Health Innovations, which is a healthcare consulting company.
All right. That is Dr. Lucas Nyabero, member, and as he said, and is also a member of Pharmaceutical Society of Kenya, speaking to us about World Pharmacists Day, a day which is being celebrated today by pharmacists all over the world. Thank you so much for making time. We are taking a break. We're coming back with more conversations. Stay with us.